News that 2 more people have contracted the swine flu virus in Providenciales, while 4 people have been classified as suspected cases on the island and 3 more suspected cases in Grand Turk, has residents sitting on a cloud of panic as they prepare for a possible outbreak. While News 4 was unable to interview health officials today, a press release from the Government Information Services revealed that one of those new cases is a person who came in direct contact with that 16-year-old boy, which News 4 reported on Monday was the first to contract the swine flu in the TCI, while the other infected individual is a visitor to the TCI who was also one of those referred to as a suspected case in an earlier press release by GIS. There are now 7 suspected cases of swine flu in the Turks and Caicos. Health officials say they are waiting for lab tests to confirm whether or not these individuals are indeed infected with the swine flu virus. Some residents also told News 4 that they are upset with the Ministry of Health for refusing to reveal the name of the teenager who is believed to be carrying around the virus and is reported to have come in contact with several students during a graduation celebration. 3 of those students developed respiratory symptoms and have now been classified as suspected cases. One resident told News 4 that he believes that the name of the person should be released so the public can be informed as to if themselves or their children had contact with that person. However, health officials remain tight-lipped on the situation and firmly stated that they will not release the names of the infected individuals. Results received on July 7, 2009 confirmed one of the students to be influenza A H1N1 positive. The results of the 4 other students are still pending. All of the other suspected cases were placed on Tamiflu in order to remain home. While medical officials attempt to break the cloud of fear in the hearts of residents and farm out the origin of the virus, they are in the meantime advising you to take precautionary measures to protect yourselves. Quote, cover your nose and mouth whenever you're coughing or sneezing with the tissue and throw the tissue away after use. Wash hands often with soap and water, especially after coughing or sneezing. Use alcohol-based hand sanitizers in the absence of soap and water. Try to avoid close contact with sick persons, especially those with a respiratory illness. Avoid touching your eyes, nose, or mouth as germs are often spread in this way. At this time, the Ministry of Health says they do not believe that this case is due to in-country transmission of the virus. However, investigations into the source of this infection are ongoing. For WIV4 News, I'm Angie Toussaint.